Hi, and welcome to this edition of Healthcare Leaders in Simsbury. I'm your host, Kurt Palmer. If you've been with us before, you know this program is about the people assets we have here in town, specifically those people who either live or work in Simsbury who have had significant impact and leadership positions in healthcare, insurance, and employee benefits. I'm so pleased to have with us today a leader of a company that is involved in one of the most rapidly growing segments of the healthcare industry, telemedicine. Lou Daniels, who has a 30-year history in insurance that covers life, health, and property and casualty. Lou has been involved and had leadership positions in several national companies such as Genworth Financial, Willis North America, and Wells Fargo Bank. Lou is currently the CEO of a company called Call a Doctor Plus, which is a telemedicine services company. So Lou, welcome, and thanks so much for being here.
Thank you, Kurt.
Great to have you on the program.
Thanks, I appreciate it. It's wonderful.
So one of the first things that I like to ask each of my guests is how you happen to end up in Simsbury and your experience here in town. I know your business is located on Up Meadow Street, but maybe you can share a little bit about your background in Simsbury.
Well, you know, Simsbury is such a vibrant and wonderful town. It has so much to offer. And for me, as I was looking to locate my business, we fly people in, we fly people out. And so access and convenience was important. And as we started to look around where we wanted to be a little bit off the beaten path, but we wanted to still enjoy that convenient factor. And Simsbury had so much to offer relative to hotels and restaurants and things of that nature. So it just was a natural. And then we were so embraced by the Chamber of Commerce, just so many services that we didn't even know were here in Simsbury. So we were very fortunate to be able to find a spot, and we love being here, and we hope to be here for a long time.
Well, we hope so as well. And I mentioned you're involved in telemedicine, also known as telehealth. Maybe you can help our audience understand what that really means. I'm sure a lot of people have heard the terms before, but may not understand really what that means.
Sure. You know, telemedicine has been around for a long time. Some say it dates back to the Korean War when somebody would get hurt on the front lines, and then they would call that injury or that casualty into the MASH unit, who would then tell them what to do on the front line. So it's the ability to communicate that information. So really, telemedicine today is the ability to speak with a doctor 24/7, 365 days a year, and have that doctor be able to consult with you and to be able to diagnose and prescribe right on the spot. So you can begin to think about the advantages both to an employer and an employee when it comes to telemedicine. From an employer standpoint, your employees become well faster, less time off needed. When they need time off, they can use it for actual vacation time as opposed to sick time, because everybody's gone to paid time off days and it's all kind of aggregated. From a employee standpoint, you truly save time and money. With our plan, there are no deductibles, no co-pays, no claims to file. So at 11 o'clock at night, when you're sick or you have that child that may be sick, you can call the doctor, consult with that doctor, and if necessary, he can give you a prescription. 1 o'clock in the morning, the child or you spike a fever, you want to talk to that doctor again, you pick up the phone, call the doctor, and that doctor can get that prescription into the 24-hour CVS as needed. The interesting thing about telemedicine is it's kind of evolved where it's gone from just telephonic to now you can use your phone, your smartphone, your iPad, or even your computer to talk to a doctor. So it's really started to evolve, and not to date myself, but if I think in terms of the Jetsons, way back when, that cartoon where the screen dropped and you're talking, that's literally what's going on now. The chance to talk to a US-based, US board certified doctor in your state who can help you diagnose that issue.
And so is the way in which you're communicating not just about the prescribing of medicine, but also maybe the diagnosis? So in effect, the doctor who is able to see you via smartphone or tablet or computer, where there's literally a visual connection, are they able to then, at least in some way, diagnose your symptoms using visual connections?
They are. I mean, certainly the visual is important, but 95% of all telemedicine comes through telephonically. And it's important to say that telemedicine is not meant to replace the PCP or to compete with your doctor. Telemedicine is used for really soft issues, the cold, flu, sinus infections, those things that you really know about, that you've had that prescription once before in your life and you're saying, I can really save some time here by not going to see a doctor or going to an urgent care center or to an emergency room by just picking up the phone or dialing in to talk with the doctor. So it truly is supplemental as far as that goes.
And I would also think that given the environment of a doctor's office, where you have other patients who are ill and perhaps contagious in some way or another, to the extent that you can get the care that you need, at least on a preliminary basis, and not have to be in amongst those other folks, that may be an advantage as well.
It is a big advantage. Telemedicine is really built around two premises, convenience and access. The convenience of being able to do this in your home or anywhere, on the road or on vacation. I had one woman tell me this year she's going to Maine and she'll be at the beach. And inevitably at some point, her and her husband have to lose a day at the beach because a child has an ear infection or something like that. Now the convenience of being at the beach and being able to call a doctor, have a doctor on the phone in about 8 minutes, and to be able to get the prescription she needs is going to be a big deal for them. And then access, you may, as you look around Connecticut or any other state, you see all these urgent care centers starting to grow in every shopping plaza. And that's because it's becoming harder to access a physician, especially for non-emergent care. So that's the purpose for many of these urgent care centers, which can be expensive also to go for care. So now the ability to access a doctor and the convenience of your home, those two combinations makes telemedicine very popular.
Yeah, it does make sense as an alternative, or as you said, as a supplement to what the doctor must do when you're in that doctor's presence.
Sure.
Your background obviously is deep in insurance. How did what you've done in the past sort of lead you to telemedicine, or what sort of equipped you, I guess, to get into this field?
That's a great question. When I graduated college, I went right into the insurance business, and for most of that career, I've been on the healthcare side of things. So, watching healthcare and seeing how it's changed. But the thing that's most interesting about being in telemedicine relative to my career is most of your career, as you're going through the insurance gates, we'll say, are spent helping an employer save money through their health insurance plan, either through cost containment or raising deductibles, raising copays, whatever it may be. And some of those costs have been passed on to the backs of their employees. Right. And the hope was that they'd become better consumers and everybody would win. And that experiment failed, obviously. And all we've seen is healthcare costs going up and employees paying more out of pocket. With telemedicine, the beauty of telemedicine, what I like most about my job and my career is I'm helping employers save money by cost containment, by using telemedicine, which costs pennies. You're not using traditional insurance, so you're driving down the healthcare cost for them. And for the employees, if they don't have to come out of pocket for a deductible or a copay, they're saving money. So it's the first time in my career where I feel I'm doing good work on both sides of the ball, and I can feel good about that. So really, coming up through the ranks of healthcare and everybody scratching their head wondering where the Affordable Care Act was going to go and how that was going to affect people, as telemedicine came more into vogue, really the combination of the two became very effective. And so that's how I got to where I am.
In terms of the relationship that a patient would have to a provider in a telemedicine environment, is there a one-to-one relationship the way you would have with a primary care physician, or do you end up talking with different docs depending on when you're calling or what your symptoms are, or how does that work in terms of having that one-to-one relationship?
Sure. Because we want telemedicine to be used as supplemental care and not in place of your PCP, most likely you're going to get a different doctor every time, because doctors sign up for time slots. And so as somebody needs care, that doctor will be paged or beeped. It's really a concierge service of putting the patient with the doctor. So that doctor is then paged and he comes on the phone. So we're careful not to really promote this as that supplemental care provider. and not compete with the doctors. As a matter of fact, after you go through a session or a consultation with us, we'll ask you, because of HIPAA, you have to say yes, but we would like to share the information of that consult back with your doctor, and we can do that by way of fax or by email. So it's part of your EMR. So when you know, sometime later when you go see that doctor and he says, I do see you had another sinus infection back in June, that's right, I was talking to one of the teledocs that was able to diagnose that. So we try to share that information back with the doctor as much as we can.
Well, there's obviously been widespread acceptance by employers and also employees,
Sure.
and so thus the tremendous growth that we've seen in the industry, because as for all the reasons that you cited. What would you say are the near-term prospects? In other words, you've had all this significant growth. Does that flatten out? Does it continue to go along that same ascending curve, or
Sure.
Where does it go from here?
Sure. I think the best analogy for that might be, and you'll remember when car phones first came into vogue. My first car phone was this box that was on my shoulder. We had very little service, and we walked around like we were in the Army with this communication box. And then we went from the car phone, we went to a mobile phone, a car phone, a cell phone, and then a smartphone, and then beyond. And really, we're at the car phone stage with telemedicine. It's going to continue to evolve. As a matter of fact, there's devices now that are being tested that will be on your cell phone, where you'll be able to put your cell phone on your chest and maybe get an EKG. You can put your finger on your phone and we'll get pulse rate and blood pressure and temperature, all information that gives the doctor more to diagnose. So telemedicine is going to continue to evolve, and what we're seeing right now are the early stages. Probably what's going to happen is you're going to see this segmentation. Telemedicine is going to be every day. You'll drop the tele and it'll just be the way you get your medicine. You'll triage first through some type of video consultation with a doctor, and then he'll tell you whether you need to come back or go to an urgent care center or something along those lines. So it's going to evolve that way, but you're going to see it more in segmentation now, where you're going to see it in nursing homes, the ability to roll in a cart where the doctor can put visual eyes on a patient and help decide whether that patient should move to the emergency room or not. You may see it in schools, where the ability now for a child who's sick to be able to talk to that doctor. In nursery schools, where mom and dad are away, but they can communicate in with the doctor. They can all be tied in when somebody identifies the child has a fever. What should we do? So you're going to see more and more of those types of applications, segmentation into different areas that will just easier to get care. Again, convenience and access.
Well, as we've talked about in past programs, healthcare is probably one of the major industries in this country, at least, that has sort of lagged in terms of applying technology. So it's encouraging that this kind of technology can be put to use, and looks like it will be, not only now but for the foreseeable future.
Sure.
So,
Yeah.
in terms of the environment and sort of who stands to gain or lose in telemedicine, I know you make a point of saying that telemedicine is supplementary to the doc, the traditional doc, and you don't want to displace that relationship or that person's role in the delivery of care. But obviously, and I've done some reading, there are certain legislatures in states around the country, there are certain physician groups that are not enamored of telemedicine.
Sure.
And maybe you can speak to how
Sure.
that plays in terms of your own business or the
Sure.
business generally.
Well, you can appreciate, I spoke at a Chamber of Commerce breakfast several months ago and talking about telemedicine, and the doctor stood up during questions and said, you're infringing on my business. And I says, no, we're trying to supplement your business. That the fact that you have patients that come into your waiting room and have to spend an hour and a half on a flu, cold infection or whatever, now you can practice medicine and things. You'll still get the same amount of seeing patients as you normally would. So from that standpoint, we don't feel that telemedicine is really infringing anywhere. The issue has been, how do we create that doctor-patient relationship so that we can diagnose? So how can somebody just pick up the phone and a doctor tell me what's wrong? Well, there's some things that happen behind the scenes with telemedicine. Before you can have a consult, you actually have to go online with our company and you have to register. You have to tell us about yourself. You have to tell us the meds that you're taking. You have to tell us about some of the frequent illnesses that you had. Those are all the things that'll come up on the doctor's dashboard as he's talking with you. He'll verify all that information, and then he'll ask you if anything has changed, and he'll update that information. So whether we're doing this telephonically or we're doing it by video, we're getting, although we may not be putting eyes on you telephonically, we're getting all that same information as if you were to walk into an emergency room and they gave you that clipboard to say, tell me about yourself. So the doctor is getting all that information, and that's how we establish a doctor-patient relationship, and that's what allows him to go forward with the consultation. I should say that we are not afraid to tell somebody, you need to get to an emergency room or urgent care, or tomorrow you really need to see your doctor. And when I talk about the fact that telemedicine, you can call our doctors as often as you need to, chances are if you're calling on the third time about the same issue, we're going to move you along to your own doctor, because now there's something underneath what's going on here that seems to be a little bit more concerning. So we're going to move you to your doctor. So I would say that our doctors, are happy to prescribe either behind the counter or in front of the counter. That many times will tell you what you really have is a cold and you may need some Robitussin, and this is what I suggest that you try, and maybe call us back in 2 days and let us know how you feel at that point. So those are the things that I think once doctors get comfortable with how we do things, they feel less threatened by the service itself.
And how about from the legislative side of things? I know in Texas there was a pitched battle between the physicians and the telemedicine companies, and the legislature was involved in trying to figure out who was going to win the day and whether telemedicine was going to be allowed to be delivered in the state of Texas. Maybe this is happening in other states, but what would the legislature have as a reason not to want to have this kind of business go forward?
So the legislatures are concerned about, again, the ability to create that doctor-patient relationship. Some laws were starting to speak to the fact that you must see a doctor first on that issue before you can see somebody on telemedicine.
In person.
In person. That kind of went by the wayside. Some laws in some states, and it has held, is you can only do a video consult, because that way we're laying eyes on you and we can see you, and then we can make that judgment call. Telephonic is not allowed. But mostly the concern is about that patient-doctor relationship and how we get the information, previous information, into the doctor's hands so he can make an informed decision about your general health, in total, and that we're not just getting bits and pieces. And that's what the legislators are most concerned about, that we're giving a comprehensive diagnosis, that we have as much information as possible in front of us so that we can diagnose correctly. I will say that our organization, and we have over 13 million members now, has never been sued, has never had a malpractice suit brought against us, because we stay within the confines of those softer issues rather than getting into the acute and chronic issues.
So I think you mentioned this, but all of the consults that your doctors through telemedicine are providing, those are transferred or uploaded into the electronic medical record that a primary care physician might maintain. So,
yes.
So thus the comprehensive picture of the patient.
Yes, and it may be you tell us that you don't want that shared with your doctor. Some may have a relationship with a doctor that doesn't want them to think that you've kind of cheated on the doctor, so to speak. But for the most part, 95% of the time they say, yes, please upload what happened today. Or you can think about a child at school that has it, and now mom or dad want to know what happens. As long as, if that child's over 18 and approves it, we'll provide mom and dad with what happened that day for a diagnosis. But again, there's an opportunity to save time. A child going to school up in Boston, you don't have to pick that child up, bring him back, see the doctor for the same illness that they've had so many times as a youngster, get that same medication and drive the child back. Now the convenience of their dorm, they can call, talk to the doctor, get the 24/7 CVS, and they're on their way. So
It's so much of what happens in healthcare is economic or financial related, as you alluded to, trying to drive down costs and,
Right.
and minimize the expense for the individual. I think I have this right, that the federal government in the Medicare program has now agreed to reimburse telemedicine consults. And so that to me opens the floodgates for utilization and adoption as well, I believe, and I want to talk about the insurance companies themselves, but some of the major companies, insurance companies, have also agreed to reimburse for this. So, so patients who take advantage of telemedicine and consults over the phone or via video are able to cover this on their insurance. Am I right about that?
That's right. 36 states today have approved the Medicare reimbursement for the program, and by the end of the year, it'll be all 50 states. I think they recognize that this truly is the last frontier when it comes to cost containment that can help both employer and employee relative to their healthcare expense, and they want to promote telemedicine rather than to do anything that would hinder people from using it. So that you will see those types of incentives. And of course, the insurance companies recognize that, you know, the most expensive claim to exercise is the smaller claim for an insurance company. So now if we can start to remove these smaller claims from being filed and having to be processed, then the insurance companies will work with the bigger claims. There's less cost and expense. Hopefully this will have this cascading effect that'll help drive healthcare costs down. If you are an employer that has a self-insured plan, you're a self-insured plan, there is no reason in the world why you wouldn't add telemedicine to your program. Because when you're using telemedicine at pennies, you're not using traditional healthcare. Every month you'll start to see, for those folks that are using telemedicine, you'll see your claims cost begin to tick down, and you can begin to track that. So telemedicine is one of those benefits that has an immediate effect for both employer and employee.
And probably a corresponding increase in employee satisfaction, that they can get some of these services done, without the need to go into the office or the added expense of going to the ER, for example.
Well, I hear this from from the employees and the employers. It's been tough economically for people to get raises, or raises that are of some substance that make a difference in their life. Yet, if you can give them telemedicine, which is very inexpensive to provide, and they don't have to come out of pocket 10 copays at $35 or $40, or some type of deductible at 80/20, you are putting more money in their pocket by providing the telemedicine benefit. So it is a morale booster once the employees understand it. The hardest thing about telemedicine is educating the employees on how it works, because the more they use it and the more they utilize it, the greater the savings for everybody involved. And that's where we come in. We do a great job in making sure we educate and motivate the end user to try the program. Once they try it, they always go back to it.
Now, are you doing that through the employer, or are you doing that direct to consumers if the employer allows you to, or how does that marketing or education and information management, so to speak, with employees come about?
So it is a combination of both. It's the employer allowing us to come in to do some on-site visits, setting up a table with maybe some coffee and donuts, getting people to understand it, even registering them right there on the spot. But also, once they're in our database, we try to drip on our employee members at least once a quarter. And it's things that are interesting. For example, as we go into the summer now, what's the difference between poison oak and poison ivy? And, oh, by the way, if you get either, make sure you call a doctor. Or in the winter when it's cold and flu season, there's actually 5 questions our doctors can ask that can help them determine whether it's a cold or flu. So we do those types of educational things, bee stings, simple things, but it gets them in their mind that the next time that something happens, make sure you try calling the doctor first before spending all that money going to an office urgent care or emergency room visit.
So a lot of the insurance companies, as I was mentioning before, are getting involved and offering this, but maybe you can clarify how that works, who does what, how you fit perhaps with those insurance companies.
So, there's different types of telemedicine out there, and the insurance companies are offering a type of telemedicine. It's toe in the water type of thing, where they're offering you a program that's in your plan design, but there's a $49 copay that goes with it. So if you'd like to use the plan, you can, but when you call the doctor, you take out a credit card and they're going to charge you $49, which again saves you time and money, and you usually had a copay anyway, so maybe it all equals out in that regard. I'd like to say that the type of telemedicine that insurance companies are offering is a lot like when you go and buy a car and they just offer you an AM radio. You go out and buy a nice car and you only get an AM radio, you're saying, what the heck, what's going on here? You want satellite, you want FM, you want great speakers. So the other telemedicine that we offer is a more comprehensive plan that has no deductible, has no copay, and has no claims to file. So you use it at will, and that's more of a robust type of program. The type of plan that's sometimes offered by insurance companies gets lost on page 37 of the employee handbook, and nobody knows they have it. So our job really as a company that offers it is to show you the different levels of telemedicines out there and help you decide which one's right for you and your employees. It'll help you save time, money, and make people healthier sooner.
Yeah, I don't mean to put you on the spot with this next question, but I'm curious as to what you would say the proportion of cost, if you will, of the complete medical cost that an employer might face can be addressed through telemedicine. In other words, is it 5% of what they would otherwise have in the way of claims? Is it 20%? Is it something along those lines? Or?
Sure. The best way that I can probably answer that question is based on return on investment, and that's what we work off of. We, in the industry, we take a look at the utilization, and by the utilization, we can tell you what your return on investment would be based on what we're going to charge you for the program and what you'll get in return. Mm-hmm. Commonly, in many cases, it's 200% ROI or better. And in a lot of cases, it's 400% or better. Because the more we can educate those employees on the program and get them to utilize the plan, the more savings the employer would see. I've been doing this for 4 years, and there's probably only a handful of times where it's been a break-even or an employer has not made that break-even point. And that's only due to the fact that they haven't gone out to educate and allowed us to come in and talk to their employees about the program. But in most cases, I would say that our book of business, which is sizable, we're running at a 38% utilization across the board, which is significant to have 38% of your employees, and you grow from there. Year after year, your utilization will grow, and so will your savings. So I tell employers that, well, it's not a silver bullet. You're going to get savings in the first year, but if you stay with it, it'll continue to grow your savings, and it'll help you drive down your rate increases on your traditional healthcare program.
Well, I think awareness is a major thing, and I have to believe that people will become more and more steadily increasing level of awareness for telemedicine. And the information is great. I hope the audience has enjoyed hearing all the comments and understanding more about telemedicine. Again, something that you're most likely going to see in the coming months and years ahead. So I want to thank Lou very much for being on our program. I hope you'll join us again for the next edition of Healthcare Leaders in Simsbury. Thanks for joining us.
Funding for Simsbury Community Television is provided in part by contributions from viewers like you. Thank you.